difficult and unprecedented circumstances during this ongoing pandemic. But at the same time, all over the world, security institutions and personnel have played a key role in mitigating the devastating human, economic, and security costs of the COVID-19 pandemic. Governments quickly put in place measures to manage and contain the pandemic, sometimes with more, sometimes with less success. And they called on security providers to act beyond their usual roles and responsibilities. Strong capabilities in crisis management, logistics, and medical support of security institutions were mobilized to enable or facilitate response measures. The new roles which security forces had to take on put them in much closer contact with local communities than what is usually the case. Here in Switzerland, for instance, the federal armed forces have just been asked a week ago or so to support the federal and cantonal government's vaccination campaigns. However, this also comes with great risks, and it underscores the importance of public trust and confidence in the work of security institutions. Or in other words, security institutions can only be effective if they enjoy broad trust among the populations, if they respond to all the different security needs, and if they are held accountable by oversight bodies, and if they cooperate closely with their partners in the health sector who are doing their utmost to prevent and contain health crises. The COVID-19 pandemic revealed and exacerbated inadequacies in security and justice systems, most of which had already existed before the outbreak of the pandemic. In some cases, the need for reform became much more clearly apparent than it was previously. This book forms part of DCAF's initiative to promote good security sector governance in the Asia-Pacific region. We, as you know, maintain a network of over 20 partner institutions and SSG associates who are experts working on security sector reform issues for South Asia, Southeast Asia, and East Asia, who come together and share experiences at both sub-regional and regional levels. This morning's book launch forms part of the network's 2021 Asia-Pacific Security Sector Governance Forum, which is taking place this week. The book is the result of a joint and collaborative effort between all network partners to draw some first lessons from the roles played by national security sectors during the ongoing pandemic. I'm now looking forward very much to receiving a taste of the book by listening to our speakers and the discussion which will follow. So please make sure to download the book and to share it as widely as you possibly can with your colleagues and your networks. But for now, thank you very much for your interest and your participation. And over to you, Albrecht. Thank you very much.
All right, thank you very much to Ambassador Thomas Gerber for his welcoming remarks. I'm also very excited about this book that we all have been.
Albrecht, your internet is. Albrecht, your internet is. Yeah, now it seems to be back.
Yeah, it seems to be a little bit unstable. I'm doing the hotspot here, which is usually the best, but hopefully it will go all right. I'm sharing some slides here, and in fact they're quite heavy with pictures and photos, and maybe that's why my system is a little bit slow. Here you see the book cover and then also a flyer that everyone is welcome to disseminate, and we will be sharing that briefly and shortly. And here you see again the book cover, kind of a bit of a PR attempt here. we have been working on this book since last year. The idea sprung, of course, from the pandemic that has been affecting all of us, but also the fact that a lot of the work that we have been doing or have been doing since March 2020 has happened virtually, where we couldn't travel, where we couldn't meet. And so we also thought this is the right moment to sit down, to reflect, to analyze.
Albert, your internet is again not great.
Okay,
You're back.
Flores. Okay, good. What we want to do today is myself, then Flores and Sabina will give an overall introduction to the book, and then we will hear a taste of the three sub-regional analysis in the book on South Asia, Southeast Asia, and East Asia, and then we'll also hear from our colleagues in India, in Cambodia, and in Taiwan, and they will talk about their own contributions. And this will be followed then by a Q&A period. Now, we were a rather large group who worked on the book, and here you'll see reflected basically all of our security sector governance associates who are part of the network in the Asia Pacific region, who have all contributed to the study and to the publication of the book. We're greatly grateful.
Your internet is again interrupting. What I think we can do is that I start sharing screen right now, and then hopefully your internet will be better. Can you perhaps stop sharing screen?
Yes, I just did that.
Okay, then now I will start sharing screen, and then I'll just switch whenever you say so.
Okay, that's perfect. All right, good. Please go to the next slide. All right, thanks. So I'll just give a short volume overview of how the book is structured. Following the introductory chapter, the second chapter, on which Flores will then share some comments, offers an overview of some of the challenges to and the responses by security sector actors worldwide during the COVID-19 pandemic. And then the next three chapters offer sub-regional overviews on South Asia, on Southeast Asia and East Asia, of the impact of COVID-19 and the responses so far by security sector actors. At some point when we started the book project, we thought that perhaps by the end of 2020, at the latest mid-2021, the pandemic would be over, and we could already maybe embark on a second volume and then look back and learn all the lessons that have been learned from a pandemic that had ended. But of course not so, as we all know. We find ourselves still in the middle of this. So now the three sub-regional analyses.
It's again interrupting, Albrecht. And now you seem to be back again.
Let's see.
Yeah.
I'm switching to a different network now. It usually never fails me here, the sunrise, but it does now. Can you hear me now, Flores?
Yeah, we can.
So let's see if that works better. Now, the three sub-regional chapter, they focus on three main themes. So here, and I have some pictures here in the first slide, the first set of themes looks at the health and security implications of the COVID-19 outbreak, the capacities of the health and the security sectors to manage the outbreak, and then the relationship between health and security sectors. What are some of the key health challenges? What are some of the key security challenges?
Albrecht, it's again interrupting. It might be better to
preventing.
There you go. It might be better not to keep it too long since your internet is a bit unstable.
Okay, all right, we'll do that. So the first set we see here looks at the relationship of health and security sectors. And please, the next slide. The second set of questions that the sub-regional chapters look at focuses on the roles that have been or are currently performed by security institutions. Next slide, please. And the third set of questions that the sub-regional chapters look like focus on how do we prepare for future health crises. Here we incorporated lessons, for security sector actors to be better prepared in the case of similar or even worse crises.
Once more, it's the
Albrecht, do you want to try to switch off your camera, maybe?
Okay, I'll try that. Okay, but with this, I'm pretty much done, and I'll hand over to Flores, who will talk a little bit about kind of the global picture. Flores.
Yes, thank you very much, Albrecht. So as Albrecht already indicated, I'll first take a little bit more of an overview of the global picture outside of the Asia-Pacific region, because I can imagine now, I mean, we've seen a few examples of how actually SSGR and the COVID-19 pandemic interact or intersect. But I think it's good to give just a few very concrete examples of how in the rest of the world this interaction has played out. So I'll just give some examples from a few countries where now on the screen you can see the example of Brazil, which is I think one of the most salient and interesting examples where you see this interaction and this tension as well. For instance, on the right side, between on the one hand civilian oversight and on the other hand an increasing role of the military. For instance, on the right side you see Health Minister Eduardo Pazuello, who is, as you can see, an active duty general, which raises a lot of questions about the role of the military in this kind of response, since for a civilian ministry like the Ministry of Health, having an active general on top raises many questions about accountability. On the left, you see a completely different example, which is actually a gang which is normally engaged in the drugs trade. This is in one of the favelas of Rio de Janeiro, which in the beginning of the pandemic actually took a very active role in distributing medicines. And I think it is a very good example where you can see how other security sector actors, non-state security sector actors, what we don't necessarily think about, can suddenly play a role in such a pandemic response. So I think these are just from Brazil, some interesting examples how you see different intersections between security sector actors on the one hand and COVID-19 and then the health security response on the other hand. So with that, we go a little bit further north to the United States to give some examples there as well. On the right hand, you see two police officers. I think they're from Harrisburg in the east of the United States. And what you may notice is that they are wearing scarves. And this actually goes back to something that you all might remember at the very beginning of the pandemic, where there was an acute shortage of what's called PPE, personal protective equipment. Now, many security sector actors, especially, for instance, police officers, are really at the front line of and are most exposed as a sort of contact groups. And for them to have a lack of PPE is and can be, at least endanger them quite directly. And I think this picture really goes to exemplify that, and how also the police really needs to be prepared for these types of pandemic situations, even though this is now much better. It was one of the core themes at the beginning of the pandemic. And on the left, you see an American or US Navy ship, the USS Mercy, if I'm not mistaken, which you may remember at the beginning of the pandemic in the United States was very much centered on New York. And here they sent this Navy hospital ship. But at the same time, and this is perhaps a little bit less well known, is that a few weeks after that, a big New York Times report came out that actually, because of a variety of rules and regulations on these Navy ships, they were not allowed to take infectious patients. So corona patients couldn't go on there. And again, I think it shows how security sector actors, in this case, the military, can play an enormous role also in helping support the public health system, for instance, yet also how their preparedness needs to fit in the schedule. And with that, we'll sort of take I'll take a jump across the Atlantic to West Africa, in this case Liberia and Sierra Leone, which both of whom are interesting examples, since they had to deal in 2014, 2015 with the Ebola epidemic. And you see, for instance, in Liberia, where there was very quickly a very capable contact tracing system set up based on the Ebola lessons, and very much also in coordination between different government ministries, community leaders, and basically community representatives in general. And in Sierra Leone, where these same lessons also apply, below you see a very big, or you see a picture from a very big prison riot, which is also a good example of where tensions can boil over in these health crises, which we also now saw in the COVID-19 pandemic. Just to keep going in the interest of time, go further east also to Iran and Israel. On the top in Iran, you may remember that Iran was one of the main hotspots in the beginning of the pandemic. And you also may remember that actually around this time, there were very big protests and demonstrations in Iran. And what happened is that there was that these demonstrations fizzled out because of also the fear for the coronavirus pandemic. But that already by itself shows an intersection with basically with accountability and also with democratic oversight. But perhaps more importantly, also what in Iran played a very big role was censorship and distrust of information coming from the government because of these reasons. And I think that also again shows how this dynamic can play out. And the picture on the left is the logo of the Mossad, which is the Israeli intelligence agency. And some of you may remember how also throughout the pandemic, the Mossad actually took a very active role, for instance, in acquiring vaccines, in acquiring personal protective equipment, in acquiring ventilators, which became a very visible role, which is unusual for intelligence agencies, but also goes to show how they can actually play an active role in pandemics, and how there is a need to think about what these intelligence agencies are doing, and that obviously goes far beyond just Iran and Israel in this case, but they're salient examples, I think. And then just to finish off, some examples of how the coronavirus pandemic plays out, with some examples from Europe. I think that the picture on the top right, to me, is one of the most impactful pictures that I've seen throughout this entire pandemic, which is also the role that you can see from non-state community leaders, like religious leaders, in this case, Pope Francis, who in this case really made a specific appeal to solidarity and to believers to follow the rules of the government in the interest of public health. And this also reminds me, for instance, of a fatwa which was issued in the United Arab Emirates. And I think it's a good example also of how religious leadership plays into this conversation. And the other pictures are on the bottom, and this is something which I think from my generation, at least, I would have never expected to see and saw for myself as well, is how the borders in Europe once again were closed. And this is a picture on the left of the border between Switzerland and Germany, which is one of the most open borders in Europe usually, and the same goes from the right, which is the border between Germany and the Czech Republic. And it shows how border guards and border control suddenly made a comeback as well, and how they play a role. And last, on the left, you see French police officers who were controlling during the quarantine, the confinement in France, where nobody was allowed to go on the street except if they had an attestation, basically a reason to be out. And for this, over 100,000 police officers and gendarme officers were deployed. I think all of that together shows a little bit of a global overview of just how many different security actors around the world actually immediately were called to duty and have supported the global effort to to manage the COVID-19 pandemic. With that, I would like to give the word back to Albrecht, or perhaps even directly already to Sabina.
Yeah, please, Sabina, go ahead.
Okay, Sabina, yeah.
Thank you, Floris. So zooming in from the global perspective on the Asia-Pacific region, and just shortly in our event, we're going to get more on a granular level on South Asia, Southeast Asia, and East Asia. But in general, these sort of lessons, trends, and general recommendations came through from all three subregions. The first being the role of the armed forces. So Floris just picked up the role of the military had been an issue in Brazil. So in the Asia-Pacific region, overall, their strategic advantage was seen as their logistic capabilities, such as handling bulk materials, supply chain management, and distribution of relief goods, especially to hard-to-access places. During the pandemic, there was a shortage of medical supplies and personal protective equipment that became a widespread obstacle. From this experience, countries realized the importance of maintaining national stockpiles, as well as emphasizing the need to create strategies for when there are disruptions to import and supply chains, such as developing domestic production capabilities. And also the armed forces showed their strategic advantage in terms of their transport capabilities. Development of dual-use civil military mechanisms had been recommended, but armed forces must always defer to civil response mechanisms. Otherwise, they risk unchecked powers during emergency situations. So this is sort of the counterbalance to their strategic advantage. Clear demarcation of roles is very important in maintaining the boundary between the military and civilians. And in this respect, internal doctrines, military manuals, and SOPs, standard operating procedures, should be adjusted accordingly. Next slide, please. The intelligence community has been collecting and monitoring data, which is very helpful in contact tracing. They've been using cellular data, credit card and other electronic purchase records, social media messages, and CCTV to identify, contact, isolate, and treat people who may have been in contact with those who tested positive for the COVID-19 virus. However, on the flip side, this should not become routine monitoring of civilians, as the international and sometimes national right to privacy must also be respected. Next slide, please. Border management played a huge role, as border closures and travel restrictions were a huge marker of what we've experienced so far in this pandemic. In Asia Pacific, border management was heavily relied on. Because border management plays a gatekeeper sort of position, they're in a prime position to conduct screenings and health checks, but that assumes that they need the training and the know-how. There needs to be some infrastructure for very basic but still very effective health training, capacities for quarantine, checkpoints, testing, and screening management as well. A particular challenge for border management was high density locations such as refugee camps, where spread of virus can really risk, where the virus can really risk spreading fast. Next slide, please. In terms of international and regional arrangements, I'll leave ASEAN and SAARC to Southeast Asia and South Asia, but the World Health Organization, overall throughout the Asia Pacific region, it came through that the World Health Organization needs to strengthen its cooperation and timely information sharing. However, the Asian Development Bank, International Monetary Fund, World Food Program, and specific UN agencies did help in providing money, food, machines, testing kits, and PPE. Next slide, please. And finally, looking at the media, public dissemination of accurate and timely information has been more important than ever, and the media has helped in tailoring that kind of messaging so that it can reach all communities and reach remote locations. However, that assumes that the information is accurate, with emphasis on their dissemination of accurate information. And combating misinformation and disinformation has been a huge challenge for Asia Pacific. That risks causing panic, fear, and false information can really hinder progress in tackling the pandemic. Next slide, please. So the way forward, COVID-19 has provided opportunities. First of all, we've understood better the connectedness between traditional security and human, more holistic approach to security. It's given us the opportunity to strengthen our accountability and effectiveness of security sector institutions and actors now in the event that there may be, hopefully not, but a future health crisis. And finally, the nature of the COVID-19 pandemic has really shown the added value of a global, regional, and national and subnational approach to face the common challenges. And with that, I'll end and hand back to Albrecht. Thank you.
All right, great. Thank you very much, Sabina. I think my computer has recovered again. It was overheating, almost burned up in front of me. So now I would like to hand the floor to Upasana, to give us a little bit of an impression of the sub-regional chapter in South Asia.
Greetings to everyone, and I hope everyone is in good health. I will request Flores to put the presentation up. So the book has been a great opportunity to reflect a little in depth on the health crisis and its preparedness and response from the security sector perspective in South Asia. At its core, the COVID-19 pandemic was seen as a public health crisis in South Asia, but its effects did enhance persistent political, social, economic, structural inequalities in most of the countries in the region, and rendering some groups more vulnerable than the others. I would like to thank all the contributors of this chapter for their time, guidance, and sharing their country perspective. Change the slide, please. But I think, Flores, this is the other slide. Yeah. Yep, that's it.
This is the right one, no?
That's the right one. Slide.
Okay.
Yeah. So I would like to thank all my contributors of this chapter for their time, guidance, and sharing their country perspective. And off to next slide. There have been a number of findings and patterns that were drawn in the South Asia chapter of the book. However, I would like to highlight a few of those. Experience in most of the countries reinforce the significance of clear legislative and regulatory framework to reflect the new national and regional health-related roles and responsibility of the security institutions. Most of the countries in the region relied on existing National Disaster Management Act and the Epidemic Disease Act of 1897, which was enacted to address the cholera epidemic which hit the region during the British times. So there were additional numerous executive orders, ordinances, decrees that were passed by the respective governments to address the gaps in the above mentioned laws. And the current crisis now has given an opportunity to review the existing legislations, national security policies, associated plans and guidelines to make the security response and preparedness architecture more coherent, accountable, and efficient. In most of the countries, the discourse about drafting comprehensive communicable disease control legislation or updating the existing epidemic disease legislation is already underway, and we are closely observing and engaging with them, and we look forward to the coming months when they will be drafted and promulgated in the parliaments. Next slide, please. Another reflection I would like to segment is the human rights approach to address the COVID-19 response. The region did witness in different degrees excessive use of force by the law enforcement agencies, stigmatization and discrimination, gender-based violence, issue of digital divide, cyber crimes, quarantine and restrictive measures, and also shortage in access to supplies and vaccination. However, there have been active oversight by the National Human Rights Commissions, even judiciary and civil society organizations in the region to monitor and address these violations of basic human rights. And though having said that, there definitely needs to be more efforts needs to be put in this respect as well. Change the slide, please. On police, with the pandemic spreading widely across the region, the law enforcement quickly became overwhelmed and had to balance their existing normal service demands with additional responsibilities in the region. Law enforcement had to coordinate its response with public health and medical officials, many of whom had not worked with them previously. Such circumstances did underscore the need for an integrated policy and operational approach, which acknowledges the linkages between public health and security delivery. And there has been a need which has been concluded to have a clear guidance and clarity of their roles and responsibilities. During the chapter writing, it was also realized by many countries that are right now consolidating the lesson learned for the law enforcement agencies to perform professionally and with accountability, that community-oriented policing and community engagement has come out as one of the good practices during the COVID response. And it will not only make them more professional, but also will help them in gaining trust and confidence of the people and carrying them as a service, not as a force. And lastly, the role of South Asia Association for Regional Cooperation, SARC. At the start of the COVID crisis, the members of SARC did convene to address the health crisis. And it was after a long time, and they moved beyond their political impasse in the organization, and efforts were brought together to see how collective response could strengthen the disease surveillance, support production and procurement of medicines, to mobilize supply chains, and look into harmonizing the border migration and travel policies. However, mechanisms of regional cooperation still needs to be further strengthened to effectively contribute to positive health security outcomes within the member states. With that, I will end my presentation, and thank you all for listening and your time. I will hand it over to my colleague, Kevin.
Good afternoon, everyone. So I would like also to start by stating that I'm here only sharing the result of the work of all our partners in Southeast Asia. So they've really done the main work here, and we'll hear specifically about Cambodia after, but that's a work across the whole network. And also to say that I will highlight a few points, but as the title of the presentation says, which are only main takeaways. There's a lot of other very important points that came out of this study, and I would encourage everyone to have a look at the full publication. One point that came particularly important in Southeast Asia is the need for oversight, but also the challenges to apply strong oversight mechanisms during such crises. Oversight mechanisms actually struggle to function during restrictions. For example, parliaments in most countries could not convene as they usually do. Civil society also struggled to have its normal operations. So the role of civil society in providing check and balances due to emergency powers and the misuse that can be made of emergency powers is actually stronger during the time of such crises, but it tends to be reduced because of the restrictions. So that's something that needs to be checked upon. Again, to avoid the misuse of emergency powers, for example, or by security institutions or government. The budget oversight is particularly important because special budgets are voted quickly and needs to be spent swiftly to respond to the emergency, but that's also created a higher risk of misuse of budget. There needs to be a dedicated legal framework to allow such specific oversight during crisis response, and that's something to think of for all government and institutions before the next potential crisis as it might happen. And that raised the question of the need maybe for dedicated oversight bodies, which would have special adapted knowledge and expertise also to carry out check and balances during times of health crisis. Another aspect that came strongly in Southeast Asia is the need for strong communication and awareness raising. For example, the security institution, the army or the police needed to apply restrictions of movements and lots of different restrictions, but they needed actually to do it not only from an enforcing the law point of view, but also communicate with the population, do awareness raising. And that's often something they are not trained into. And there is an identified need to carry out more training for them on those aspects. The role of civil society organization and media to support efficient two-way communication between government and population has been highlighted, meaning to make sure the right messages reach the population to reduce panic and fear, but also that the problems and struggle from the field are mentioned and transmitted to the central authorities. But at the same time, there is a role for the government authorities in maintaining the condition that the CSOs and medias can play this role. As mentioned before, it's been noticed that through emergency powers, unfortunately, a lot of the time, there was restrictions on operations for civil society organizations. And it's really important to make sure they can still play the role of oversight, but also of communication between a population who is exposed to fear on top of health issues and the government who needs to understand what's happening in the field. So there is a need for an inclusive and transparent dialogue between government authorities and the population during the response, but very importantly, when designing response plan, that all these potential issues of communication are raised beforehand, and that security institution, government authorities, but also local security actors and oversight bodies knows which role they will play in this communication system when the crisis happen. Overall, proactive communication reduces the impact of fake news, which we've seen was a particularly big problem everywhere, but in Southeast Asia as well, where people in remote communities did not even know where to seek appropriate information that could create panic movements and sometimes even tensions. Lastly, I would like to speak about the need to support the most vulnerable communities and individuals and the role that the need in doing so of a regional response. In Southeast Asia, we know there is a very large migrant population, and more globally, the population is very mobile for economic reasons, in some cases for tension within countries. And this population needs to be taken into consideration when the borders have to close in emergency. Sabina mentions what's being done at the border, but there is also need to make sure that wherever this migrant population is stuck when border close, they are assisted. Would they be citizens of the country where they're stuck in or not? And also strong cooperation between countries that should be supported by the ASEAN as a regional body to make sure that people are taken care of independently from where countries they're from. And specifically that applies to some marginalized population, for example, stateless people or some marginalized communities, to make sure they are receiving proper assistance and timely assistance. And finally, in many countries in Southeast Asia, you have very remote communities with very limited communications and logistic means to reach central parts of the countries or central health infrastructure. So there also there is a need to make sure those most vulnerable communities are reached, and the security institutions need to have that in minds when they do the response, that even remote areas where you might have tensions or infighting should not be left aside when there is a response. And coordination with local security actors, even sometimes non-state security actors or ethnic armies, are very important to make sure that civilians are helped wherever they are located. That's just a very few highlights from Southeast Asia, and I will now leave the floor to my colleague Ray to present some from East Asia.
You are muted, Rohit.
Thanks, Kevin. Let me put my slide. I'll proceed with my presentation. So as my colleague has said previously, this chapter has been prepared with support of our SHG associate from East Asia, who has provided the inputs and the feedback throughout the chapter, as it took almost a year to finalize this chapter, and also the book in overall. And you will hear much more detail about the country perspective through our colleagues from Taiwan, who will be looking into the case of Taiwan. So what I will do is I will try to focus on the key findings, of the East Asia chapter, and here I would like to focus on the two key areas. So one of the areas that we could find out through our chapter was the focus that the countries in the region has invested a lot on epidemic preparedness and the management, both for the health and also for the security sector. And this has happened because of the previous lessons from dealing with the SARS and the MERS, I mean the severe acute respiratory syndrome SARS, and also the Middle East respiratory syndrome MERS. So that they have acquired a lot of lessons learned on how to deal with this crisis. So in respect to that, they have prepared both their health system, but also in terms of their security system, in order to how to deal effectively in this kind of crisis. Let me share one example with you that came out through our chapter. In the case of Taiwan, after the experience with the SARS and MERS, the government, they designed several intergovernmental mechanisms, the measures, and also they introduced a lot of laws and legislation, such as the Communicable Disease Control Act, and regulation was introduced in order to fight infectious diseases. So that was introduced based on their experience of dealing with the SARS and the MERS. And these laws and regulations allow the health sector, especially the Ministry of Health and Welfare, to collaborate with other government agencies, including the security institutions. And also based on this act, the Taiwan Armed Forces, I mean the Taiwan Security Institution, are directly under the command of the Central Epidemic Command Center, especially during such health crises. And they carry out the various tasks designed by the CEC, I mean this command center, to cope with the COVID-related challenges. And as I said earlier, using this experience and dealing with the SARS and the MERS, Taiwan CDC has since strengthened its ability in responding and managing the potential pandemic. And we will hear much more detail about the Taiwan's response in the presentation in the next session. But basically, what we learned through their response was that there was establishment of sound institutional mechanisms such as CDC, and this is very much applicable in the case of South Korea as well, but also the mainland China, and also in the case of the Japan as well, that they have developed a sound institutional mechanism to effectively respond to this pandemic through sound legislative framework, and also design the better institutional coordination mechanism to respond both at the policy level and also at the operational level. Sorry. And in relation to my previous kind of point, they have also set up the institutional and the legislative framework. So for instance, in the case of East Asia, institutions such as the Korea Disease Control and Prevention Agency, KDCA, and the Taiwan Center for Disease Control, they have actually played an instrumental role in terms of both coordination between the health and security institution, but also across the other government department to effectively manage and control the COVID-19 response. Just to give you one more example, for instance, in South Korea, the legislative framework such as the Infectious Disease Prevention and Control Act allowed the mobile carriers, I mean the telecommunication, to share the individual data during such health crisis. And basically this helped the intelligence services in collecting information and also kind of regularly having an access both from the visiting facilities such as pharmacies and from other medical facilities, and also to review the data. I mean, the data that they get from the individual calls, like the cell phones, and also from the credit card transaction logos, and also from the CCTV footage of the general population. So this information collected helped to verify and also kind of provided both the tracing, I mean, in terms of contact tracing, and also kind of isolating the individual citizen. So, but basically what the findings suggested was that this act, I mean, the introduction of this act mandates this kind of access, I mean, from getting access from the private telecommunication companies and also from the National Police Agency, because as during such health crises, the center like KDC, I mean, the CDC center could request such kind of information from these respective agencies in order to design and tackle this kind of response mechanism. So basically, just to conclude, what we have learned from our findings from the East Asia was that the lessons, especially the recognition of the establishment of such institution and also the legislative mechanism, has helped to deal with the COVID-19 responses in much more effective manner. Having said that, we have also witnessed the new variant that has emerged of late, which has kind of further created a lot of challenges for the governments in the region to respond as well. But they have been managing to deal with them through such institutional and also the legal mechanism. And lastly, to highlight as well, it shows that this institutional and legislative framework help to better coordinate and better mobilize the security sector institution in order to respond, and could kind of avoid any kind of misinformation or disinformation that we have witnesses during the COVID-19 situation as well. And lastly, I would also suggest, I mean, the findings also suggested that it would be better if we conduct further detailed understanding how this CDC, I mean, the institutional framework and the legislative framework acted and operated in most of the countries in East Asia, so that we would have further detailed understanding of this, how it worked and what it didn't work, so that it could be shared with the wider countries in the Asia Pacific region for them to adapt to deal with the future crisis. And I think with that, I will stop my presentation here, and I will hand over the floor back to Albrecht.
All right, thank you very much. We're a bit running late. And with this, we immediately go to some inputs from the chapter contributors. And the floor first goes to Roshan, who focused on India. Roshan, please go ahead.
Thank you, Albrecht. Greetings to all of you. And firstly, I would like to congratulate Alberto Pasna and the entire team for publishing this book. And it will be a great inspiration to many people as they can learn from each other's best practices as enunciated in this book. As far as now India is concerned, I would like to say that India, as we know, had also initially faced a lot of problems as far as the healthcare and security sector was concerned. Though we had a lot of legislative acts like the Disaster Management Epidemic Act, and the government had declared it as a biological disaster, which enabled them to have a lot of wide-ranging powers. But in the absence of specific guidelines, it created a lot of discretion at the executives. So that had its own challenges. But since then, the things have settled down. And I would like to first talk about the positives, what has been the experience, what we have seen, and then come to the challenges which still remain as far as COVID-19 is concerned. Firstly, if we take the police force, this has been a revelation, as was discussed earlier also, because we could see the good part of the policing, so to say, that the community policing came into the limelight. And if we take the case study of one of our states, that is Kerala, I would like to discuss, we found out that the relief operations which the police did, it ranged from activities like delivering food packets to nearly 1 lakh people, to keeping in touch with about 10,000 senior citizens, as also they gave counseling to about 3,000 children. Further, apart from tracking home quarantine, they also were involved in contact tracing for over 1 million people. So their functions were very varied, and it was very heartening to see the positive attitude with what they came out. And even now, we find that they have been getting ready with SOPs and with their rosters, the guidelines to sensitize the entire force. In this, we can say that we have a system called the Network of IPS Police Officers, which across the country has helped in developing good practices. Now, as far as the role of defense forces is concerned, as we had already discussed earlier also, as was mentioned, that they had gone away from the traditional duties and they were roped in for community services. And it was very heartening to see their involvement with the civilians, dealing with the civilians. And like a lot of ships and aircrafts had largely evacuated a lot of Indian citizens from abroad. The army had also created a lot of COVID hospitals and quarantine units, as also the army doctors and support systems were available for medical treatments for the civilians. There was in between in India, there was shortage of oxygen and ventilators. So a lot of aircrafts were used to ferry these from the donors. As we also know that India also share land borders and maritime borders with number of countries. So cross-border migration, the travelers had to face challenges due to closing of borders or few entry points. And that time, the army really came forward and helped the people in testing, in transportation, and supplying food and medicals to these people. The army's fast chain of communication was used for a lot of logistic things. As far as another important thing, what I would like to say was the technology, use of AI, especially drones, have been a real game changer, especially if we see the India's northeastern states have tough terrain, and often we find the last mile connectivity is not there. So it has been heartening to see the use of drones in delivering important life-saving medicines, the vaccines, and also collecting blood samples and so forth. In the security sector, also the drones have been used for mapping and surveillance and reconnaissance in the border areas. Now, as far as the economic is concerned, as we know that economy has a direct bearing on the security of a nation, and unemployment had created a lot of anxiety, stress, and gender violence. So government had created a lot of economic packages to the low income groups so that they can look into the daily activities. And the other area which I would like to highlight is the migration issue. We had faced a lot of problems as far as the migration, both interstate migration was and the interborder migration was there. So now the things have a little bit settled down. The government firstly is trying to give a lot of economic packages to the migrating laborers, because it was found that they had no work, they had no money. And apart from that, they had also created a lot of control rooms so that any grievance from their side could be sorted out. And there has been a large amount of database which could be used. Similarly, the NGOs also had been roped in. The Niti Aayog coordinated with nearly a large number of NGOs and civil society organizations, because they had a lot of what you call it, connectivity with the lower section of people. So they were utilized for their services in a lot of these activities. Now, as far as the challenges are concerned, we know that health crisis has seen that the mandate cannot be handled by any one particular agency. It requires a lot of coordination. And so now when the need has been to see that whenever the SOPs are being done by the paramilitary, the home guards, the security sectors, they need to create a system where joint operations take place, and the health sector is also taken into the national security sector. Secondly, the communication links needs to be strengthened. This is especially significant because in India, policing is a state subject, and it requires interstate cooperations. And the organizational link between the health departments and the police institution needs to be strengthened. Another long-term view is the development of the capacity building. Because it has been seen that during the COVID times, there were gender-based violent cases, and child and women trafficking had also increased. And the number of police force per population was very less. And so and more so with the number of women police officers. So it needs to be looked into, and the gap needs to be addressed. And it was often found that gender-based violence had increased, and often the NGOs were unable to cope because of the containment zones. So police had to go with a lady officer there. So this needs to be looked into. Another important aspect is the digital platforms, which had played a very crucial role, especially the video conferencing, digital passes which were made, and often the modus operandi during lockdowns were this only. So the experience has highlighted the importance of ICT connectivity, and this needs to be built up. There is a need to have a proper digital base, monitoring and surveillance facilities, share coordinates with the relevant sectors, and these needs to be looked into. Further, there are two bills which are pending in the Indian Parliament that need immediate attention. That is the National Health Policy 2009 and the Public Health Bill 2017. And I'm sure these would be looked into. So the focus, I feel, should be to ensure that strong regulatory mechanisms are in place to address joint integrated health crisis management framework, and early warning systems and plans for security sector need to be inbuilt in a nationwide whole of government approach. So these are some of the examples and the way forward, how to go forward from the Indian perspective. Thank you so much for allowing me to share my opinion.
All right, thank you very much, Roshan. And of course, Roshan Kanijo, she's a research director at the Center for Strategic Studies and Simulation at the United Service Institution in Delhi. And with this, I'll hand the floor to Kim Soon, who is a research fellow at the Cambodian Institute for Cooperation and Peace in Phnom Penh. Kim, please go ahead.
Thank you, Alfred. Again, thank you for a floor. Let me just try to update you something regarding to the article. So when we look at the Cambodia security reform, we should look at to the period that Cambodia reached a Paris agreement to end the Indo-China War. I mean, the third Indo-China War on the 23rd October 2021, because this one is the one that really show about the achievement of Cambodia to accept the peace operation from United Nations in Cambodia in 1992, and then we have the national election in 1993. A new constitution also happened in 1993. It's also a time that we can see exactly a peace operation plus a democratization in the country. And then the extraordinary court or chamber in Cambodia as a hybrid court also established. And then we also developed the defense white paper in 2002 and 2000 and 2006, which talk about the development of the security reform, particularly a reform of defense. And then we also have Cambodia also have under the framework of defense and cooperation with United Nations, we also send the blue hat of the Cambodian soldier to support the UN peace operation around the world. For example, Lebanon, Sudan, and South Sudan, and Mali, for example, and you see the number is 787. And then regarding to military reform, actually, one thing that we could see exactly is about how to reduce a number of general. If we're talking about this, I would like to just say a little bit fun for Cambodia. We do have many of the general Okay, but because of reform, we could cut out cut out the number of a general. You can see exactly clear from the 1920 to the 200 in the year of the 1990s. And then regarding to the military reform, personally regarding to the ground troop, you could see that Cambodia have sent a lot of military to train abroad. For example, in Vietnam, you can see the number. And then you can see also a number of military to go to train in United States, in Indonesia, and Russia, Australia, as that I mentioned in the slide. For example, currently we still have a student that study in the West Point in the United States, that they come to a different field, for example, at the field of Navy and the field of Air Force, as a clear example that I mentioned in the slide. And then regarding to the military, in a situation of COVID-19, frankly, Cambodian military played an important role to support the frontline medical care teams. First, they play a role in order to transport the people from one place to another, particularly the people who got the infected. They also play a role to transport the food from one place to another. The military medical team also support the civilian medical team to inject the vaccination to the people in the red zone. When I talk about red zone, is a place that the area that the infection of the people is a lot, that is really difficult for a civilian medical team to go. So we just send a frontline, they send the military medical team to go there. So when you see the slide, for example, the military region 5 infant Belgrade 51 is the one who sent to that area, and also some of the sent to the place that in order to protect the lockdown place in the time that the government just want to protect, not to spread the what we can say the virus. And then with that also you could see that because of the support from the military team in terms of vaccination, the increasing or I can say that the speed of a vaccination is really fast. You could see just a small example that I got from the Facebook page of the Ministry of Defense. You could see that just only 1 month, the number of vaccination is up to 1 million because of the military activity. And at the same time, with the support from the military and also the civilian medical team, we do believe, and we know exactly clear the statistic now up to the 14 million of vaccination people among all the 16 million as a total population in Cambodia. Regarding to police reform, we can see that this case, Cambodia actually, we have a people who have a not just only if you want to in Cambodia, we talk about the level of 1 star, 2 star, and 3 star or 5 star. Normally we have a clear format to do so, but because of a lot of corruptions happen, everybody can get 1 star, 2 star, or 3 star easily. So with that regard, the Ministry of Interior also have some kind of a policy that reduce the star. That if you look at that, the Prime Minister Hun Sen said that they're hiring military officials that have, for example, 1 or 2 star general should be downgraded. And then with that regard, we have to make exactly clear that what kind of position of the police that they have a position as a general, and then when we become a general, how many stars they should wear. They cannot just only just a small number of the police, and then you have almost all are the general position. Regarding to the that in terms of international area, Cambodia also have a kind of the training with the police Interpol, that we work closely with the kind of police in order to fight against the terrorist group and also human trafficking, for example. With that regard, the government of Cambodia also do some reform about the position of the people in the government, because in Cambodia, 1 person can have 2 or 3 positions at the same time. If they work for the government, they can be the member of parliaments, they can be a position in the Oknya as people who have a lot of money, and then they also have people who they can be a star. With that regard, the government of Cambodia just say no. The people 1 person should have 1 position only, not many in the government. With the COVID-19, we do see exactly clear about the role of police is to protect the people, I mean, to support the government to protect the people in the lockdown place. First, not allow the people to go in and go out without the permission. Second thing, the police also play a role to support the military to bring food to that. But we have some criticism that police also do some kind of punishment, like a torture to the people, that they do not listen to what the government order. For the judicial sector, we do believe that during the COVID-19, we want to have a place that have a lot of space, because we want to run away from the the spreading. But in the prison, actually, Cambodian prison is too near a lot of prisoner is in. Therefore, what that the government sees about this, it just want to make sure that the case of the prisoner can be speed up, in order to relieve some of the prisoner, in order to make sure that they can avoid from too much spreading in the prison. This is some kind of thing that you consider. We do some reform that we have to send. I mean, the government order to the Ministry of Justice to send many of the judges, as many as possible, to the province and other area to proceed the case. And then regarding to digitalization, actually under the COVID-19, one thing that Cambodia government have done a good job, particularly the Ministry of Post and Telecom. They established a Stop COVID-19 QR code. This code, of course, we see a lot of criticism regarding to privacy, but frankly, for the government, they know exactly how the people get infected, how the people quarantine, and how the people link to the other people they are not, infected with the COVID-19. So through that, they can manage exactly clear how many people infected daily, and then can help support the government to manage the situation of the COVID-19. Regarding to social issue, again, 2020, of course, in the article, we could see exactly clear that Cambodia faced a lot of problem. The economic, the situation of the people was not easy. Many places in Phnom Penh and some province like Siem Reap and also Dimajay province also locked down. But in 2022, we see some, 2021, we see some good sign. The good sign is, more than 14 million people was vaccinated, and then the people start to move slowly, and they start to back to normal, but they have to accept the prevention and mechanism from the what we can say, the government. So the economic issue, we do believe that it's reached to the point of a what we can say a downgrade of 3.1%. But 2022, we do believe that Cambodia can work well. But of course, challenge is about the corruption. It still happen. The government still have only one party in the government, and then the government put more pressure to the people during the COVID-19. Also arrest the human rights activists. And also what that we can see exactly clear is the vulnerable people, particularly the people that work for the informal worker, that they have no chance to do it already before the COVID-19, but when the COVID-19 comes, it's a big problem. So that is, I think it's a conclusion to me, because I don't have time to conclude everything. This is my recommendation. Thank you so much. I will give the floor back to you, Albert.
All right, great. Thanks a lot, Kim. And with this, we'll go to Li Jiang. He's assistant professor at the National Defense University and a fellow at the Taiwan Study Center in Taipei. Please, Li Jiang, please go ahead.
Okay, hi, everybody. Now I'm sharing my screen. So I hope you can see it.
Yes, it's there.
Okay, just haven't heard that two presentations about their own country cases. I'm now sharing my own view, and as Rohit just briefly explained how Taiwan has countered or fought the COVID-19 since the beginning of last year. I just briefly introduce you the current situation of COVID-19 cases in Taiwan. As of just about today, we only found one new local case. So just one. So total cases of COVID-19 since last year, 16,700 something in total cases, which is I think relatively low in comparison to many countries in the world. And the total death so far, 849. And the vaccination rate, the first dose rate, coverage rate, about 79%, and the second dose rate, 65%. So country now has spent so much effort on at the moment on the full coverage of the second dose vaccination rate. And the vaccination, the Ministry of Health and Welfare, which is the superiority organization of the CDC, play a very important role in preventing and managing the outbreak. And as Rohit just briefly introduced, one of the important or successful reasons for Taiwan so far has dealt with the COVID-19 is that we had the law or act in place due to we had the experience of SARS in 2003. So this law called Communicable Disease Control Act, also called an acronym CDC Act, provides the Ministry of Health with the adequate role and the capacity to respond to the health crisis. And as I said, the SARS in 2003 really gave Taiwan a harsh lesson, and Taiwan had no experience dealing with such a serious epidemic situation so far. So after that harsh experience, Taiwan has established laws, regulations, acts, and spend all sources and prepare all personnel, education, researches in place. So to deal with such great scale pandemic or epidemic, so that after 15, 18, or 17 years of SARS, then we faced the COVID-19. And since that lesson, I think Taiwan has so far dealing relatively well, at least so far, in terms of the countering the COVID-19. And also after the 2003 SARS, there is a such plan called National Pandemic Preparedness Plan, which composes 4 major strategies and the 5 lines of defense. What the strategies I just briefly introduced, which is surveillance and assessment, interruption of transmission, and antivirals and the vaccines. And the 5 lines of defense, that means containment abroad, border control, community epidemic control, maintenance of medical system functions, and individual and family protection. So this is the 5 lines of defense. And the surveillance strategy includes grasping international epidemic conditions, which closely watch what happened in the world. That is also the key reasons that Taiwan can counter such pandemic, because we react relatively early. Why? Because I think we understand the situation there. So if we found out there's something wrong, and some information that has been released is insufficient. So the Taiwan's intelligence services actually dug in about to further understanding of the real situation. So we realized that the situation is not what was released, and in fact that was far more serious than what was released. So we carry out such preventive measures relatively early. I think that's the key reason. And the health surveillance for incoming passengers, surveillance of epidemic trends, surveillance of COVID cases, surveillance of virus activities, and the case investigation, including the travel tracing and history, collection of virus-related information, and transmission interruption. Just give you a quick look. For example, contact quarantine, regional quarantine, cancellation of public gathering or activities, social distancing, closure of public places in case of there's a spread out of pandemic cases. And border control is so essential that so far makes Taiwan relatively safe, because we block all the potential positive cases of COVID-19. enter Taiwan. Even though once they enter Taiwan, they have to experience very strict 14-day quarantine in either the quarantine hotel or the quarantine isolation center. The procedure was very strict, so that even you walk out of your door, once you are detected by the CCTV or was reported by anybody, you can be heavily fined. For example, it could be reached like $30,000 fine if you violate that law for the 14-day isolation or quarantine. So that is one of the key reasons that so far keep Taiwan safe. But who maintain or make sure that regulations can be respected? That is the security sector. So that is why security sectors play a key role in maintaining Taiwan's COVID-19 cases relatively low. So I would just skip this because another very important reason for Taiwan to responding COVID-19 is so far successfully, because the establishment of CECC, Center for Epidemic Control Center, very early, which includes intelligence section, operations section, and the logistics section. And under this CECC is a command, because the commander is the Minister of Health and the Welfare. But under his command, anything related to the pandemic, that means you see all the logos here. That means all ministries: Ministry of Defense, Ministry of Foreign Affairs, Ministry of Interior, National Police Agency, Ministry of Science and Technology, you name it. All ministries, in terms of the COVID-19, were all under his command. So once he ordered a command, or any single ministry must offer what is necessary to assist or help under the command of this CECC commander. So all the country efforts has been spent to fight the pandemic. Okay, so the center set 4 phases. I will just skip this. And in terms of the procedures to counter the COVID-19, digitalize all procedures. For example, online reporting for entry, home caring, and track with the technology. Okay, so in terms of the security sector in fighting the COVID-19, the need for security sector involvement in preventing and responding the COVID-19 is essential, and it's so far quite well implemented in Taiwan. Taiwan because Taiwan government has treated COVID-19 as a national security level, and so that Taiwan upgraded and categorized the COVID-19 to the national security level, so that any decisions can be reached to the top of the government. And Taiwan established cross-sectoral cooperative system, placed responsibility for strategic planning under hands of Ministry of Health. And local governments serve as the implementing bodies. Public health sector did not possess the expertise and authority in law enforcement, investigation, and the border control. So that is why it needs to involve the security sector. For example, Ministry of Interior, which controls the police, and the Ministry of National Defense, or the National Immigration Agency, in assisting all the country's efforts to fight COVID-19. Challenge of cooperation between health and the security sectors. There is a good cooperation between health and the security sectors in Taiwan. Because of the SARS experience, several intergovernmental mechanics, measures, and laws, for example, as I said, CDC Act and the regulations in fighting COVID-19 are already in place. The laws and the regulation allow health sector, which is Ministry of Health, to collaborate with the other government agencies. And the CDC Act might use the another act called All-Out Defense Mobilization Readiness Act system to implement and to mobilize all resources, materials, and the personnel once there's a need. And we actually mobilize such resources to counter the COVID-19. Capacity of security sector to assist health sectors. Police maintain public safety, crime investigation, information gathering, and the sharing cracking down on fake news and disinformation, enforcing isolated or quarantined people, and ensuring they stay home or stay in the quarantine center. National Immigration Agency, NIA, is in charge of border control at airports and harbors, and investigating overstayed foreigners and foreign laborers. Ministry of National Defense, which armed forces maintain national defense and security, setting up field hospitals, deploying chemical corps or chemical troops to conduct hygiene tasks, mobilizing military hospital to accommodate COVID-19 patients, and mobilizing military personnel to produce strategic resources such as face masks. And Ministry of Justice Investigation Bureau, MJIB, is in charge of investigating crimes that related to COVID-19, information and intelligence gathering and sharing, and cracking down on fake news and disinformation, which is if there's a spread of fake news related to COVID-19, they can be heavily fined and heavily punished during this the time of emergency or crisis. National Security Bureau is in charge of gathering the information about COVID-19, and also National Security Council convened regularly and those meetings to discuss and set guidelines for and the policies for countering COVID-19. So armed forces.
Li Jiang, could you please wrap it up within the next 15 seconds,
okay,
because we only have 5 minutes left.
Yeah, okay. So this is military. What military done? This is intelligence, as I said, MJIB, and intelligence gathering is vital. And police, what police has been doing to make sure that the people stay home if they need to be isolated, and they also conduct daily routine missions for ensuring personal and public safety in the society. And this is what they have been doing. So for the testing the driving drunk, they themselves are also well protected with the personal protection equipment. And border control, as I said, the NIA, National Immigration Agency, play a very important role for blocking those potential cases abroad. And local security actors in Taiwan, there is no tribal forces, warlords, rebel forces, militias, and even we don't have any private military company in Taiwan, so there's no such issues. And the media, civil society, and think tanks also play very active roles in terms of helping those peoples in need, and making publications of researches. And the legal framework, as I said, CDC play a very important role as a basic framework, a basic legal framework to set up all the legal foundations for all ministries to carry out their jobs. So also we'd like to promote international security sector cooperation. This is just a few days ago that our representative office in Philippines donated face masks to the Filipino police agency as a goodwill gesture for international cooperation. So that will be my own experience and observation of Taiwan's case in terms of fighting the COVID-19. Thank you very much.
All right, thanks a lot, Li Jiang, and thanks a lot to everyone giving their presentations. As everyone can see, there's lots and lots of rich information in there, and I'm sure everybody could have talked for another hour on their chapters and their contributions. And the best thing is just to go there and dig it all up yourself. But with this, we're almost out of time, but we still certainly want to give you the opportunity to make a quick comment, perhaps, or anything you would like to share with the group. Is there anyone I can give the floor to? Maybe a question? No? I guess everybody is aware that we're running out of time, and it's also for most of you getting pretty late in the day as well. So with this, I'd like to just say a word of thanks to everyone who now contributed to the book launch event. We've heard a bit about the book in general. then we also got a sense of what the three sub-regional chapters focused on South Asia, Southeast Asia, and East Asia, and we've got a pretty good taste of what some of the individual contributions are about. Then on India in this case, and Cambodia and Taiwan, and there's much more in there. Flores has just shared the link. We are still planning to take some time out at some point after the pandemic has ended. And of course, we all hope that this will be the case very soon. And then to look back and reflect on some of the initial impressions and some of the initial lessons that we have gathered already and that we want to share with you with the book. Yeah, Flores has shared the link. Book will be also on the web page. We will also be sharing some hard copies with all of the contributors. Yeah, and with this, again, a heartfelt word of thanks to all the contributors, to all of those of you who have taken the time now to get a bit of a taste of the book. And I hope that we made you curious enough to pick it up, download it, and take a look for yourself. And please, and that will be the last comment, please disseminate it as widely as possible to anyone that you think might be interested in the book and might be interested in some of the lessons, some of the chapters, and some of the experiences from the many countries we work with. And so I wish you a good rest of the day, a rest of the year, and please stay safe. Stay healthy to you and your families and friends and colleagues. And as this is also the end of our Asia Pacific Regional Security Sector Governance Forum, thanks again to all of our associates and members of the National Working Group meetings who have joined us on this occasion. And we look forward to next year and engaging again. So thanks a lot and bye.
Thank you, everyone, and good.